Still ahead, men aren't the only ones who deal with hair loss.
It's a big problem for a lot of ladies as well. Coming up, we're talking with Dr. Sharon Thompson about what can cause this and some of the treatments out there that can actually help. Now we want to switch gears here in our Health Watch this Monday morning. We don't talk about it often, but the struggle is real. About 40% of women dealing with hair loss. So Dr. Thompson is joining us this morning to talk about what causes it and what can we really do before we go down the path of all of these pricey products that are out there, because there's a lot of marketing about this. But there's also some embarrassment for ladies to talk about this.
Absolutely. We think of hair loss as a male problem. And so when it happens to women, they tend to get embarrassed. There's a lot of hidden, the information about hair loss is hidden because women can hide it, right? We can wear braids, we can wear wigs, we can, you know, wear teasers. And so it's very hidden and not talked about. There's a lot of stigma about it. But it is common. 40% of people suffering from hair loss are women.
So would you say that it is hormonal, or what drives it?
The most common reason is the same as for men. It's genetic.
Okay.
So the most common reason why women lose hair. But there are a couple of things that happen to women in particular. So we know we've talked a lot about women having babies. Well, a very frequent occurrence about 4 to 6 months after you have your baby is you start losing hair. Women start complaining, oh my God, my brush is full of hair. That fortunately is temporary.
Okay.
That is simply temporary. You will not lose all your hair, and your hair tends to go back to its normal volume and fullness. But as women get older, they can experience balding similar to men, but the pattern is different.
Okay.
So women tend to maintain their hairline, but they get thinning in the crown of the head. Yeah, so women will tend to have an overall thinning versus a loss of hair.
Yeah, it's funny how that part gets wider and wider and a little more obvious year after year. I will admit that that struggle is real for me too.
Yes, exactly.
So vitamins, you hear about a lot of topical serums. What do you think? I mean, is there really anything that you can do about this besides figure out how to cover it up well?
Most of the hair products that we use, the vitamins, the conditioners, etc., can make a little bit of cosmetic difference, not a significant difference. The thing that works the best for women who have really real thinning hair is the same as what works for men, minoxidil.
Okay.
And I forget what the names in the stores are, but you can ask at your CVS
like a
or
Rogaine.
The Rogaine, they're over the counter these days. And those work. You have to use it a couple of times a day. They're usually foams or gels. And over time, those have been found to be helpful. But your vitamins that we spend so many millions of dollars a year on, the shampoos, the conditioners, some women will experience a little bit of fullness, but they don't make a significant difference.
You know, you buy that shampoo and it has a little tingly effect and you're like, oh, well, this must be working.
Yeah.
This was worth the extra money.
And hey, if you buy a shampoo or conditioner, you feel like it makes your hair look different and fuller and you're satisfied, great, don't stop buying it.
There's obviously a lot of surgical options out there, the traditional transplanting, and then now you're hearing about the almost the vampire facial on the scalp to stimulate the hair growth.
And some of them are newer. Hair transplants have been around for a long time, and we know that those can work. The newer therapies, you kind of let other people try them first.
Yes.
I would say. But there are some other causes of hair loss that a dermatologist can help with.
Okay.
So if you're experiencing new hair loss, it's significant for you, definitely want to talk to your dermatologist. There's some inflammatory reasons why you can have hair loss, and those can be treated with steroids or other therapies. So you definitely want to bring your doctor into the conversation if it's new for you.
Might be an indicator something else is going on.
Definitely.
Or you might need to take a look at some of those medications that you're on as well, and that might be a side effect. Dr. Thompson, so good to see you. She says this is baby season right now, so thanks for taking some time to visit our friends here at AZ Family. We appreciate it.